Well, most of you just recently graduated, and I think your brains are probably full, and you think, oh, I know everything that I need to know. Well, not necessarily true. You are entering a profession, and you might not realize that. You're looking for a job, and you want to get the right job in the right location. But what I ask that you think of is think of nursing as a profession, and we don't always think that way when we first graduate. It is a profession. It is more than a job. It's a profession where you will be building relationships with physicians, your patients. You will be teaching one another. You're not always going to be the learner. You're going to be teaching as well. You will be a professional, and that's something that I think new nurses don't often think of. The second thing, I'll go back to relationships. I believe that most new nurses do not understand that the relationships they build with their patients has a direct impact on the outcomes of the patient, both the morbidity and the mortality. There's been a lot of studies done about that, a lot of research, and new nurses often think that we talk about service just for customer service sake. Now, don't get me wrong, service is very important just for service sake. Patients have choice out there, and we want them to choose our facilities, and so there is something to be said for providing good service. But what I want you to think about is understanding the relationship that service, that communication, that relationship that you build with the patient, how that has a direct impact on outcomes. For example, if a patient has a good relationship with you and you're teaching them, if that relationship is strong, that patient's going to listen to you much more than someone who just comes into the room and checks off the tasks. If you are educating that patient, if that patient knows that they trust you, if they trust you, they're going to trust the education that you give them. So they're going to go home and they're going to do what you ask them to do. So it really has a direct correlation. So I think that's important to remember. And then the third thing that you might not be thinking of, again, it's so easy just to get immersed in your job and not want to think about any other growth for a while. But you can do anything you want to do. I had no idea as a bedside nurse that I would end up as a chief nursing executive. I had great mentors. I went back to school, and my career path led me down the administrative path. But you could be an educator. You could be a case manager. You could be that nurse jumping out of the helicopter. You could be a nursing administrator. You could be a director, manager, or chief nurse. Your future is all up to you and what you do with it. And I don't think new nurses often think about that.